Assalamu alaikum. Hello, dear friends. This is one of a series of videos about hospital policies and procedures, which are written instructions on how staff members do different processes. Policies are general rules that govern our performance, and procedures are sequential steps on how we do it, and the responsible person for each step. We can update these rules when we have new standards to follow. In this video, we will talk about the policy of care of vulnerable patients. For more videos, please visit my Facebook page, Healthcare Quality, and my YouTube channel, Dr. Hassan Kamel. If you like it, please support me with follow and likes. This policy is applied to all hospital services provided to vulnerable patients, including children. The purposes of this policy are: number one, identifying the vulnerable patients and their special needs and required services. Number two, to define the care processes and its related aspects provided to vulnerable and dependent patient groups, including children, in order to assure patient safety, respect, and dignity, and to prevent these populations from abuse. Number three, to provide the reference that summarizes and coordinates information for staff related to care of vulnerable patients. Number four, training the staff to use the policies and procedures to guide care of vulnerable patients, including children. And number five, identifying the documentation required for the care team to work and to communicate effectively. Definitions. Number one, vulnerable patients is a group of patients who are extremely exposed to damage because they are unable to protect themselves or signal for help. These include frail dependent elderly patients, infants and children, immune-compromised, and patients with communicable disease, physically handicapped patients, comatose patients, patients with chronic illness, and individuals with mental or emotional disabilities. Patients may be considered vulnerable because of their age, their condition, critical nature of their illness, complex equipment needed to treat life-threatening conditions, nature of the treatment needed, and potential for harm to the patient. Number two, chronic illness, an illness for which there is no cure. Many chronic illnesses like cystic fibrosis are also progressive. That means that over time, the disease gets worse and may ultimately result in death. Number three, children, age group younger than 18 years old. Number four, physical abuse. Physical indications of abuse occur more commonly in clusters of symptoms than as a single symptom. Assess for the presence of two or more of the following: bruises, welts, lacerations, puncture wounds, dehydration, malnutrition, fractures, signs of over-medication, burns, poor hygiene, lack of needed medical attention, multiple injuries in various stages of healing, and injuries inconsistent with explanation. Policy statement. Number one, it is the policy of our hospital to provide compassionate and competent care to all of our patients, especially the vulnerable patients, including children, who are at great risk to be abused. Number two, care of children younger than 18 years old will be done by the relevant specialties as pediatrics, pediatric surgery, pediatric nephrology, and pedodontists. Procedures and responsibilities. Number one, identifying the vulnerable and high-risk patients and services by the hospital leaders. Number two, developing application policies and procedures for care of vulnerable and young dependent patients by the hospital leaders. Number three, treating physician and assigned nurse and other healthcare workers will identify vulnerable groups according to the policy and part of the initial or educational needs assessment that require special care and protection by the treating physician and assigned nurse. Number four, detection of abuse incidents by history or physical signs by the treating physician and assigned nurse. Number five, the witnessing staff contacts the security office or patient relation office. Hospital staff. Number six, security officer and patient relation officer will proceed immediately to the specified area to do the needed actions. Security supervisor will convey the information to the hospital administration by patient relation officer and security officer. Number seven, if security staff and patient relation office staff cannot control the situation, security supervisor will call police after obtaining permission from the hospital administration. Number eight, hospital administration will take the specific actions to prevent such events from happening or re-happening. And number nine, staff will be trained in service training on adult children abuse detection and reporting system on a yearly basis. HR training coordinator. Approval of each policy is usually done by the preparing person, recommended by the department head, reviewed by the nursing supervisor, and approved by the quality director, medical director, and hospital director. Thank you. Thank you.